Greetings. This is Justin Allen, the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. Sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Jason, who is a family nurse practitioner. Currently, he is working at a mobile urgent care full-time. He's starting a telemedicine concierge weight loss and men's health clinic. He's also interested in starting a cash-only urgent care, but isn't too sure what direction to move in. He's needing assistance with pricing services, how to set up a subscription program, and how to incorporate telemedicine and urgent care into the weight loss and men's health clinic. Hey, Jason, how are you?
Hey, Justin, how you doing, sir?
I'm doing good, man. So let's go ahead and jump into this. So tell us a little bit about yourself, how long you've been a nurse practitioner for, and what sorts of things you've been up to.
Yes, sir. I'm the nurse practitioner coming up on 4 years since I've been working in urgent care since I've been an NP. Prior to becoming a nurse practitioner, I was in the ER, worked in the ER for 8 years. I'm also a retired fireman here in Tampa. I did 18 years in the city of Tampa as a firefighter paramedic. So I've been doing healthcare for a long time in different forms.
Okay. All right. And so you've been working in an urgent care, like a mobile urgent care right now?
Yeah. So mobile urgent care here in Tampa, they're the company I work for. I'll leave them nameless, but they're all over the country. They're pretty much in every state. And that's my full-time gig right now. Yeah.
Okay, cool deal. All right. So you're wanting to start a telemedicine practice. So you're wanting to focus on weight loss and telemedicine, or weight loss and men's health?
Yeah, absolutely. And then as I was thinking about this, it's kind of evolved because it went from, okay, I just want to do weight loss and then men's health. And then here in Florida, we have full practice authority. So I'm like, well, man, I should incorporate telehealth, telemedicine. And then, I tell you, from my day job and what I do, I'm a big fan of the mobile urgent care, just services in the home. And as I was thinking about this practice, I really want to incorporate that into my business. And I'm not sure how to tie all this together, but I think the mobile urgent care is a great concept, and I'm doing it now and it's successful. So I want to do it as a cash price or self-pay. I'm trying to figure all that out.
Okay. The place that you're working, does it accept insurance?
Yes, it does.
Yeah. Okay. So I'm just going to just be straight up. So cash-based acute care, cash-based sick visits, it doesn't do that well. I don't know of anyone that's doing it who is like truly successful. They might make some money, but they're not going to make a lot of money. It's hard to scale and grow a cash-based sick visit kind of practice. Okay. Think about it. It's pretty common sense. You have people who, they have strep throat, for example, right? You go to their house, you swab them, you prescribe them, amoxicillin or whatever. How often are you going to see this person? Once a year, twice a year, maybe,
But
You see their kids, whatever, there's no recurrent income with it. It's hard to scale. Like that's
well,
what
the
I mean.
one thing, yeah, no, absolutely. And when I thought about this, I want to offer this as a service for my existing patients, right? I'm not trying to advertise, hey, you know, to everyone. I just want to offer this as a initially I figure I would offer this to people who are on weight loss or
I
TRT.
gotcha.
Hey, by the way, just something as an existing service for them, you
Right,
know.
right, right. Well, in that regard, sure. My men's health clinic patients, I treat them for cute stuff all the time, you know, like
But
they just,
how do you build that though? I mean, how
I,
do you include that? So
I don't, it's part of the value. So
interesting.
yeah. So listen, okay. So these people are paying me $140 a month, right? $140 a month for the testosterone, supplies, the visits. It's an all-inclusive concierge kind of thing, right? If they have strep throat, I'm not going to charge them for that. I mean, what, I take a look and I just prescribe Septanir or whatever, it takes me 2 minutes. So I don't charge for it. It's part of the value and they get a lot of value out of it. It saves them so much time. You know what I mean? They don't have to go sit in an urgent care for 2 hours, 3 hours or whatever.
Yeah. No, and that makes sense. But the only caveat I would interject is just so I'm trying to do a full service like in their home, total mobile, go to your house, do the consultation, pull blood, do everything there. I'm already contracted with Access Labs. I have everything squared away to do all that. And then so I figure if I'm going to drive back out to their home for a sick visit, or I mean, I'm going to offer that, hey, I can for an additional 75 per visit or whatever, I can come out and see you again in your home. I'm just trying to figure out if there's a service, a charge for that. I'm trying to figure out if that's even worth it. Just hey, I come back out and do an in-home visit, a well visit, if you would like, and then I'm applying for a CLIA waiver so I can do all the POC testing. So I'm just trying to figure out how to incorporate that.
I don't think it's going to be something that's going to be one of your main services at all. So I don't think it's worth focusing on it that much. I
Okay.
really don't, man. Most of these
Yeah.
people are coming for you for weight loss and men's health services, right?
Yeah.
Yes, they get sick. Yes, they have issues, whatever. You know what I mean? But
Yeah.
I don't think it's going to be your bread and butter. I don't even think it's going to even account for probably 10% of your revenue. So I don't think
Interesting.
I would worry too much about it. People call me, they say, hey, my kid tested positive for strep. I have a sore throat now and body aches. I'm just going to call in amoxicillin for them. I'm not even going to see them. Why would I? I'm just going to use common medical sense here. You know what I mean?
Yeah. And
Like
that
I don't even see them, dude. I just call in an antibiotic for them. Like that's literally it. It's cash based. I don't have to see
yeah.
them. I don't have to take vitals. I don't do any of that stuff. So
No,
just kind of
that
keep
makes
that in
sense.
mind. Yeah, yeah. All right, dude. 1 second, man. We're gonna have to pause this. This guy's just knocking on my door. So just give me like 5 minutes, okay?
No problem.
Okay, I'm gonna pause 1 second.
Yeah. So, and again,
All right, there we go. Now start.
yeah. Yeah. So, I definitely, maybe I'm coming across, maybe I'm not, I'm trying to do so if someone called like a one off, hey, my kid's sick with strep throat and amoxicillin, then that's a no brainer. But I'm really wanting to build my business around, you know, the busy person, right? And my thought, and I'm really just to get back to the mobile urgent care. I mean, I do it every day and it's kind of a brilliant concept. And if you yourself are out on a Sunday mowing the yard, mama's busy with the babies or whatever, and you cut yourself, and who wants to stop what they're doing on a Sunday and go to an ER or brick and mortar urgent care versus having someone come and just take care of you in your home. And so to me, I'm really impressed by that. Again, I do it every day. And the company I work for, there's some things they can improve on, but that's kind of what I was talking about. And so I see what you're saying. That wouldn't be a big part of my business, but I definitely want to offer that, especially since I'm doing a total mobile service. Well, so my question would be, I mean, I guess if I only have 10 or 20 or 30 patients driving around, but I guess scalability would be difficult if I do expand and get busy. So right now, this is going to be, I have the urgent care. I work for that disaster company, response company. So I'm pretty busy. This is going to be like a side hustle. Obviously it'd be a great problem if I was so busy. I'm like, hey, Justin, I'm so busy, I have to quit all my jobs. But right now it's going to be a side hustle. But I definitely want to, put more thought, on adding these services in people's homes,
Right.
as this additional service.
Sure. So just keep this in mind real quick. I'm not trying to talk you out of this. I'm just trying to show you another viewpoint from it.
Of course.
Think about how much time it takes you, how much revenue you get from it for driving to someone's house, giving them 6 sutures in their finger or whatever. Okay. How much money you make from that and how much the time investment is for that. So something like that, I would imagine you charge what? $150, $200, maybe something like that.
Yeah, I was thinking like 200, probably 200. Yeah.
Okay. 200. Right. For, to suture someone's finger or whatever. Right.
Yeah.
Okay. Now just a couple considerations here. Number one, if they have insurance, they're going to want to use their insurance. Okay. Number two, the time investment from you. How long does it take to drive to their house? How long does it take to do the suture repair? How long does it take to chart it? How long does it take to drive back home? What's the time investment for $200, $250 here? 2-3 hours? Maybe. It depends on how far they are. If they're right down the street, then sure, it could be a lot quicker. So, I mean, you're looking at anywhere between 1 to 3 hours, depending on how far they are from you and how traffic is, right?
Yeah.
For $200, $250. You will make $200, $250 off of one weight loss clinic patient in 1 month for 15 minutes of work. So where should you be focusing your time and energy?
Yeah, I mean, that's a good point. I mean, I guess I was maybe kidding myself thinking I could do all of it, but I see your point, trying to maximize my time and value.
Right. Like as a business owner, man, listen, you're juggling a job and you're juggling a business. Okay.
Yeah.
You going out and, seeing someone's kid for strep throat or whatever, and it takes you an hour and a half travel time and everything included, and you make $80. Is that worth your time?
That's a good point.
It's not. It's not worth my time.
Yeah.
You know what I mean? They have to pay me $500 to make that worth my time, And then, and even then I'd be like, I don't want to do this,
Yeah.
So
I guess, in my mind, when I'm writing this stuff down and building out this whole concept, I guess, some of the stuff seems a little more easier in my head than maybe it's going to play out.
Sure. And listen, man, it's what it's what you're doing, right?
Yeah.
Like, why wouldn't you want to take advantage of what you know and what you're doing?
Well, exactly. And that's what my whole thought. I do it every day. So
right. And you should take advantage of that. But I would just have it as nothing more as a value add to the weight loss and men's health practice. And I would call it a day, man. I don't think you're going to make that much money doing it because, like I said, man, most of these people have insurance that pay for that kind of a thing, a $50 copay with an urgent care, why wouldn't they want to use that? The thing is with a weight loss or men's health, their insurance doesn't pay for that stuff.
Yeah.
So that's the value add. Their insurance doesn't pay for it. So you can justify charging them cash for it. Though for a suture repair, their kid having strep, man, their insurance usually covers that kind of a thing.
Yeah.
Right? Yeah.
No, you're right. Yeah.
Yeah.
You're making sense, I guess, as far as my time and value. I guess I was just trying to go too far down a rabbit hole, but I do, I am a big fan of the in-home model for treating patients. I do it every day. It's brilliant,
Okay. Yeah. So do it with weight loss and men's health. And call it a day.
Sure.
Okay. That's where the value is for a cash-based service. Okay. And you don't even have to even do it a lot, mobile too. Like you could just call it the first visit could be mobile. Okay. Like the first visit you go, you do a weigh-in, you draw blood work, whatever it is that you want to do, however you want to set this up. And then after that, man, it could all be telemedicine visits. It's a convenience factor for patients, dude. Anymore, man, my men's health follow-ups, like I typically will see the patient in person for the first visit.
Yeah.
The percentage of people that I see in person for follow-up visits is maybe 5%.
Yeah. Well, especially now that with the telehealth law still being waived for the the public health emergency, that being extended until next month, I think they said.
Nah, it's gonna be like November 2024. Yeah, it's gonna be another
another year. So.
Right. Well, that's for the initial visit. I mean, if you see him in person one time, you can see him telemedicine follow-up for eternity, basically. Okay.
Yeah.
So that's what I'm saying. Like, most of your patients are the follow-ups will be done via telemed, just a phone call. Okay. So the mobile aspect will be one of those things that, that's going to be great for the first visit, but after that, man, you probably really aren't going to need to go to their house very often. And from a time investment standpoint, You shouldn't want to. Like telemedicine's so much easier.
No, 100%. So moving on, like getting to this whole, the whole concierge and going to, so the way I envision it is I would, go in people's homes, do the weight, consultation, stuff like that, blood draw. Um, I spent all day actually, I'm sorry, an hour and a half this morning on the phone with ACA trying to figure out this healthcare clinic, waiver or license. Do you have any experience, any thoughts on if I need an HCC permit or a waiver to have a fully online business? Because
Um,
I've heard it both ways, and I called ACA and I waited an hour and a half and ended up leaving a message with somebody.
yeah. So I'm not in Florida, but this is what people in Florida have told me. Okay. You do need that if you have an actual like clinic. If it's gonna be telemedicine, you don't.
Okay.
Yeah.
So I don't even need a waiver for telemedicine. I don't need anything at all.
I don't think so. No, I think that's only for like if you actually have a clinic.
Yeah.
Yeah. If it's telemedicine only, you shouldn't. If it's mobile, though, I don't know if if you're actually going to the patient's home, I don't know if you need that or not. I don't think you would. It's just a minor regulatory thing. So,
Yeah.
You should be compliant, but at the end of the day, you're not going to jail. You're not losing your license over it,
Yeah.
Yeah.
Well, and then so my company, I've already established my company. I have the business account. I have everything squared away. But because it's a mobile service, an online service, I don't have a physical address. So I've been using my residential address for everything for, Access and LabCorp and all the pharmacies. And I know in all I've taken, I think 4 or 5, 6 of your courses, you always mention, maintain some privacy. And I mean, any thoughts or how can I get around that? If I do a virtual address, then a lot of places won't use that. And so I'm trying to figure out if there's any other way that I can get around not using my physical address, but having an online service for these accounts.
Yeah. It can be problematic. If you're like telemedicine based or even mobile based, like
Yeah.
what address do you use? Do you want to use your home address? You can use your home address for accounts with pharmacies and stuff. That stuff is private. That's not that's not public information. Okay. So you
Yeah.
could, but what a lot of people will do is what they'll do is they'll just go get like a very, very small, cheap office somewhere, like in a shared office space or like a large office building where you can rent like just one office, for like $300 or $400 a month. And then that way you actually have a physical address. Things can be shipped there. You can have your Google business listing through it and that kind of a thing. So, that's the route I would go. I would actually get an actual like physical address somewhere you could actually like store stuff, keep it separate from your home and have that Google business listing.
Yeah, that makes sense.
Yeah.
And then so moving on, I spoke with a pharmacy. I don't want to mention her name. I spoke to a sales rep from a pharmacy, one of the ones you recommended just on Friday of last week. He said that tirzepatide, they are, I guess Eli Lilly, or I think Eli Lilly, maybe. Yeah, I think that's who it is. Someone filed some kind of injunction or some kind of something official to where that can't be compounded anymore. And he says that his company is no longer going to be providing that. Have you heard? Is that going to be industry wide, or is that just this particular company that got hit with that? Or
Yeah. As long as there's shortages, they're going to be able to compound it. And then also, to my knowledge, too, with tirzepatide and semaglutide, is that there's like different formulations that they can create to where they can get around it. So, yeah, my opinion on this is that most compounding pharmacies are making a lot of money with it, and they're going to find a way to pivot. Okay.
Pivot, yeah.
Yeah. So I don't think I'd worry too much about it. And I've been saying this for, the last year and a half, 2 years. People have been worried about this for 2 years now, especially for the semaglutide listen, don't worry about it right now until you have to worry about it. It's out of your hands. Okay. So why worry about it? And also there's going to be ways to pivot from it. The compounding pharmacies will figure out a way to pivot. If they don't, worst case scenario is you go back to other tried and true methods, phentermine and other things. It's how weight loss clinics were profitable before, so yeah. And if patients truly want the semaglutide, you're just going to be like, okay, it's going to be $1,200 a month. That's how much it costs. through Walgreens or
Yeah.
whatever, like that's how much it is. I'm sorry. There's no cheaper option. So, yeah.
Well, because even on your Elite, I skim through the Facebook page when I can. There's people posting, peptides going away, and so it's kind of trying to navigate all this because obviously trying to start a business, and I'll be up and running in probably the next 30 days. Last thing I want to see is the stuff I want to offer is being discontinued, so it's a little
Yeah.
stressful to see
Well,
stuff like that.
I mean, dude, that's healthcare, right? I mean, that's just,
Yeah,
that's the issue of having a business in a highly regulated field. Things change all the time, right? And so you
yeah,
have to always be on your toes, and you always have to be, able to pivot and change. Okay. So that's part of the game, dude. Like if you want to, if you want to operate a medical practice, it doesn't matter cash, insurance, it doesn't matter what you offer. Things are always constantly evolving and changing, and you just got to pivot. Okay.
yeah,
So like I said, don't worry too much about it. Yeah. Yes. Some peptides were banned. Some weren't. Okay. You use ones that weren't. Okay, semaglutide gets banned, for example, for being compounded. You can't sell compounded semaglutide anymore. Okay, fine. You pivot. Phentermine, Contrave, whatever else, So you just got to be on your toes. We try to make announcements when we can, when we're actually, when we know,
yeah,
the actual facts, and it's not just drama and speculation and stuff.
yeah,
So,
yeah,
so we try to update people as well. But, that's just the thing, man. You always just, you got to change. You got to pivot. We used to offer a lot of various peptides at my men's health practice. A lot of growth hormone releasing hormone peptides that were all banned, or they became a controlled substance, and the compounding pharmacy stopped producing them. We pivoted. We just changed. We stopped offering it. So we just, we changed. We started offering some other things, man. Dude, a couple patients complained, but guess what? 3 months later, it was forgotten.
yeah.
You know?
Well, no, listen, that's encouraging in your energy, and you're like, it's definitely encouraging to hear because I don't know what I don't know. And I've been a guy that's been a salary worker my entire career, my adult life. I've never, my business acumen isn't very high. So I'm trying to navigate all this. So I don't know what I don't know, and just trying to
Sure.
figure it all out.
Nah, man, dude, I get it, dude. Listen, I didn't know a damn thing when I first got started. Like, I knew nothing. Like, I read some books on how to start business, and I had like
Yeah,
a mentor. Like, that's it, dude. I didn't have a course to take. Like, I looked
yeah,
for courses. I was like, man, why isn't there a course on how to start a men's health clinic? I'm gonna have to just do it myself. Then I figured it out and did it, and well, then I created a course, right? But yeah, man, like that's part of just growing as an entrepreneur. And honestly, man, there's no one you can pay to truly teach you how to do this. You have to do it.
yeah,
That's the thing. You just got to do it. We try to teach you as much as we possibly can, but at the end of the day, you got to just jump in, get your feet wet, and get going. Because I mean, things are going to change.
growing
You're going
pains.
to growing pains, man. It's like
Yeah,
fighting, dude. People are going to throw you punches. You have no idea what punch they're going to throw at you. You just got to be willing to pivot and change. So you just got to be on your
yeah.
toes, dude. That's kind of the fun part of being a business owner, man. That's what makes it fresh and new.
Listen, I'm excited. There's definitely a level of excitement. I'm just trying to, navigate everything. The semaglutide. Do you remember a few years ago, many years ago, the whole compounding pain cream thing that was going around,
Oh yeah,
where like people are, these compound pharmacies they were spending $80 to make a compounding cream and billing insurance companies $10,000 and getting
yeah.
reimbursed. And that
Oh
lasted
yeah,
about 2 years, and then
yeah,
they changed all that.
yeah.
I wonder if
It,
that's going to be like the semaglutide, if that's what happened in this semaglutide, where they're going to go there and just shut all that down completely.
you
You
know,
know?
it's a possibility, dude. I mean, it really is.
Yeah,
It's a possibility. Um, you just can't worry about it. You just got to kind
yeah,
of sit here and just wait till it happens. That's why you should never, ever, ever. And this is for anything in life, really. You shouldn't rely on one thing. You should always have some backups. That's why I teach that principle of redundancy from a
yeah,
financial standpoint. Financially, man, you should be redundant, right? You should not rely on one income source. That's foolish. You should have multiple income streams. Same thing with your
no,
business, man. You
yeah,
shouldn't rely on one service, one medication. That's foolish. You know what I mean? If semaglutide, if it happens, you know what? You should have some other stuff to provide you that backup, right? If you
Sure.
don't, and semaglutide gets banned, well, what the hell are you going to do? You
Yeah,
know?
to keep it moving, like you said, just a pivot and adjust. No, that's a good mentality. I just, you know, so moving on. I'm trying. I know you have a plumber coming, so I'm trying to get through my questions.
Yeah, for anyone like, what the hell you
Oh,
just say? Like, yeah, I
oh
woke up
shit,
this
sorry,
morning and there's a big old puddle on my kitchen. I'm like, what the hell is this?
sorry,
So
man.
like, yes, I'm sitting here waiting for a plumber, but yeah, but anyways, though.
I forgot I wasn't recorded earlier. So the so I had a demo from Optimantra and then Cario, and I tell you, man, I like Cario. Their presentation was solid, and looking at the website, I even Googled it. There's been some complaints, and the guy told me that this. Obviously, he told me they worked on things, but do you have a preference? I mean, as far as like, because Cario offers their own POS system that's 2.75% plus 30 cents a transaction. Any thoughts on using them and using their built-in POS? Have you had any experience with that or?
Um, Aereo, how much is it? How much are they charging?
So they said it was 175. Optimantra does an elite discount. There's a $65, but you have to, like, for e-prescribing, which I want, it's an extra $30.
Right.
And for something else, it's an extra $30. And if you want to have a dedicated support team, it's $500 a year. So by the time you do all the math,
It's
add all
basically
the
the same thing.
basically the same, exactly.
Yeah.
You know,
Then, man, as far as I'm concerned, it's just whatever one you like, user face wise. Um, I've I still use Simple Practice.
really.
I still use Simple Practice, man. Our men's health clinic, we've been using it now for 5 years or something, 4 or 5 years, and like, you just get used to it, and it's a simple EMR. It works for us. So it's basically just whatever one you like, 150, 160 bucks a month isn't, it's not really a whole lot. I think Simple Practice is like 60 or 70 bucks, but it doesn't have an e-prescribe feature. So then you have to get a separate e-prescribe feature, which is another 20, 30 bucks. So, I
Yeah.
mean, at the end of the day, you're gonna be spending $100 a month probably for an EMR,
Yeah.
So, if you liked Cario's interface and it's a flat $165 a month, there's no hidden costs. There's no contract you have to sign. I say go for it, but do
Yeah.
not get locked into a contract with an EMR
Yeah.
that you have to stay with them for 3 years. Never do that. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all Elite Nurse Practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and the other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
I think they said the minimum, and we didn't talk about it too long, but he said that they would do like a 6-month contract minimum. And I just, as this presentation, I didn't press back too much, but 6 months is doable. So the meat and potatoes of this call, man, what I'm really struggling with to get into the weight loss, and I hit on it earlier, is the best way to present this. And I've talked to many people, and again, I've talked to 10 people and gotten 5 different ways. So do you recommend, if I go in and do a consultation, let's talk for like women or men's health, I go in their home, do a consultation, do the blood, charge them. Should I do it seems like a lot of people nowadays are doing like a 3-month bulk. Hey, I'm giving you medication for 3 months. Is that the way to go? Do you prefer the monthly model where they're getting vials and equipment, or supplies to their house monthly? Do you have a preference on, as far as the TRT, as far as doing it monthly versus quarterly, or even 6 months at a time?
I mean, you should have both options. Okay. So the monthly is just your base, right? Like that's just your base Like that's the foundation of your pricing, basically. So like, let's say for weight loss or men's health, let's say for men's health, you charge $140 a month. That's the testosterone, the visits, the syringes, the supplies, whatever. And then the weight loss, let's say you charge $300 a month. That's for the semaglutide, the visits, supplies. Okay. Or you charge $140 a month for phentermine, the visits and the supplies. All right. That's your foundation. That's your base. You build off of that. All right. And so if they want to do 3 months at a time, you multiply that foundational amount by 3. So let's just for easy math, let's just say $100. You multiply it by 3, so it'd be $300 for a 3-month supply. And then you give them just a little bit of a discount to prompt them to purchase, a larger supply at one time, because that reduces your risk as a business owner, because you get all the money up front, right? If they pay for 6 months, give them 10% off. If they pay for 12 months, give them 20% off. You know what I mean? That's so that's what we do. So we encourage people to buy 3, 6, 12 months at a time so we can get all the money up front. All right.
Yeah.
So you just build off of that basically. So if you're charging $150 a month for, men's health testosterone, it'd be $450 for 3 months. Charge them $420, give them a little bit of a discount. You know what I mean?
Yeah.
Yeah. So that's how you build that out.
Yeah, that makes sense. This, again, some people here, like some companies, they don't even offer them monthly. Like they do it by 3-month blocks, and then every 3 months, it's a whole re-up on blood draw, lab values, or whatever. And then as far as the $150 a month, when you do repeat blood work, is that covered in your monthly fee, or do you charge them a when you when you redo labs, you charge them a fee for that, or is that included in the monthly?
For the lab work?
Yeah, for repeat lab.
Yeah, I don't include that in it because I like my patients to be able to use their insurance.
Okay.
Yeah, gotcha. It just reduces their cost overall, So I allow them to use insurance if they need to or want to for their for their lab work. If they don't, I just charge them cash, based off of the access discount pricing. So I'll just be like, okay, it's $175 for the initial lab work. For follow-ups, $100 or whatever. And I make a little money off it. So yeah.
And then, what are your thoughts on Clomid versus Enclomid?
Clomiphene versus eclomiphene.
Yeah.
I haven't seen any clinical difference.
Okay.
Yeah.
Yeah. And do you have any experience with, because a lot of guys here in Tampa, as I've talked to my friends, a lot of people are really interested in real growth, and I've called around, and it's hard, like the Optotrope, or the not the Somatrope, and the Optotrope, and the real growth.
Omnitrope. Yeah.
Omnitrope. Yeah. It's hard to find that, man. Do you offer that as your personal, at your men's health? Do you have any kind of experience with that as far as?
Yeah, we offer that. I believe we're ordering it right now. It comes and goes from pharmacies, man.
Yeah.
Sometimes I can't even keep track of it. We were ordering it from South Lake, and then we were ordering it from I think APS Belmar. I don't even know who the hell we're even ordering it from right now. My office manager handles that at this point. So, but the last time I ordered it, it was coming from South Lake. So, there's quite a few compounding pharmacies out there that have it. You just got to create a couple accounts and make sure that they have it.
Well, I'll tell you, a big problem I'm having is just, I've contacted 2 or 3 pharmacies, but a lot of pharmacies have me, hey, on a waiting list. Like, there's 2 pharmacies, big ones, that I'm on a waiting list to be onboarded because they're so busy. So like that's what I'm facing right now. I can't, I can't put together what I want to do exactly because I can't get with the right pharmacies yet.
Right. Man, welcome to saturation. Welcome to people getting, wanting to start their own practices and getting busy. And, it just, it is what it is, like, I mean, what do you do? So yeah, unfortunately, you just gotta fill out applications with other pharmacies. I mean, dude, there are so many compounding pharmacies out there. So if you explore the Facebook group and search compounding pharmacy, man, I mean, there are so many reputable pharmacies out there that might be a little bit smaller, but their customer service is fantastic, and they'll get you onboarded within, a couple days. So
now, and as far as charting and like the CPT codes, if I'm doing cash based, and obviously I'm doing charting, Do I need to put too much thought? Like if you put someone on, like, say, tesamorelin or something, do you just use a gonadism CPT for that diagnosis, or are there specific diagnoses you use for the peptides?
I'll use like low IGF-1 or fatigue or increased recovery times or, whatever it is. Just use a symptom.
Okay.
Yeah.
And then I guess my last couple of questions, man, are just basically around, you know, your thoughts on if, do you push people to cycle testosterone? I mean, I know a lot of people who've been on testosterone for a very long time who haven't cycled it. Is that something, because we want to protect people from themselves? Do you
Yeah.
encourage people to cycle, or is it just a
No.
personal
So,
choice?
yeah, cycling, man, that's when you're kind of doing it more for performance. I mean, if they truly need the testosterone, and they should, then they should really probably be on it long term. Do I have
Okay.
some patients that want to cycle just because they want to? Yes, I have quite a few who do that. They just want to cycle it. They don't want to be on it. They don't want to become dependent on it. Fine, fair enough. I mean, I can respect that, but most people really should probably be on it fairly long term, or not, if not for the rest of their life, if they're, hypogonadal. I mean, if their testosterone levels are low, and they've tried losing weight and exercising more and eating right and that kind of thing, their testosterone levels are still low, chances are they're probably not going to go up. And then you start them on testosterone replacement therapy, they feel fantastic. Why would you get them off it?
No, yeah, it's a good point. Do you have any experience with the testosterone blends, like the cypionate and deca, or any kind of like the tri blends or anything? Do you have any preference on those, or any thoughts on
Um,
those?
yeah, we've used them from time to time in a couple patients just because they requested it, but I don't know. I'm a guy that just does what works. Testosterone, sapionate, just a simple test sip seems to work for 95% of people. Various blends and whatnot. Enanthate tends to be a little less anabolic. Tends to decrease the spikes in erythrocytosis in some people. Propionate tends to cause a little bit more of a sustained level in people, but you have to dose it more frequently, 3 or 4 times a week. So, I test it for 95% of people. The other 5% who might not be responding, then I might explore some other options.
Cool, man. Yeah. Yeah, I mean, this has been great, man. I can sit here for another hour and ask you petty questions, man, but you basically covered the gist of it. I want to be successful. I'm someone who I try to obtain much information as I can. And, I just, like you said, I got to jump in the water, man, and start trying to tread water on my own. I just trying to get a good foundation of information, man. You've been great. I appreciate your
Yeah.
time.
No, for sure, man. For sure. I mean, it's my pleasure to help you out. I mean, do you have any other questions whatsoever?
The last thing I have here is just, uh, the DHEAS and treating some of like the last question here I have, anti-aging along with TRT peptides, et cetera, when's too much, right? That's the last question I have written down. Like, when, because again, trying to protect people from themselves, when is too much? If someone's wanting to do anti-aging, they're on whatever peptide they're on, they're on the NAD, the glutathione, the testosterone, the ACG, or whatever they're on. Like, when do you have like a threshold where you just won't, is it 5 medications? Like, is there a threshold where you just won't stack
Yeah.
beyond a certain point?
Yeah, man.
Because
I
there's so much
don't.
medications and so many peptides to pick from. I'm just trying to,
All
you know,
right. I'm a pretty simple guy. I like to keep things simple, dude. I don't like my patients on more than 2 or 3 things. You start giving these cocktails of things. You don't know what's causing what side effect. You don't know
exactly.
what's helping. I like to keep it as simple as possible. I very rarely start someone on 2 things at one time. I will typically start them on one thing that I think is going to benefit them the most. And most of the time, that's either going to be like the testosterone, or if it's weight loss, it's going to be like the phentermine or the semaglutide. I very, very rarely will ever start someone on semaglutide, testosterone, and a peptide. Very rarely. Okay. because you just don't know what's working and you don't know what's causing side effects. You just don't. I don't care if anyone tells you that they do. They're full of shit. No, you don't. You don't know. So I keep it simple as possible. I usually will integrate or add something else to people's protocols every 2 to 3 months. Okay.
Well, that was my next question. Yeah. So
Yeah.
like if someone wanted to do the, obviously testosterone, you want to put them on like a estrogen blocker and Clomid or HCG. That'd be pretty much standard for everyone. And then
That's pretty standard, correct? Right? Yeah. Like that would be standard
after a
for most
month,
people.
you can add this tesamorelin or whatever if they want to do a peptide. So just kind of
Exactly.
over time implement more or add more.
Exactly. And this is the thing about this stuff in general too, is that a lot of the times after 2 or 3 months of them being on the thing that you think is going to help them the most, they don't need the other thing. They're just like, you know what? I feel good. I feel fine. I don't need anything else. Like that's typically what will happen, Like you start a guy on just testosterone, and let's say that you start him on testosterone clomiphene, right? 3 months later, they're like, hey, you were interested in a peptide when you first came in. How's your recovery times? How's your weight loss efforts? And they're like, you know what? I'm doing good. I don't need anything right now. That's what happens 90% of the time. That's why I keep it simple.
Yeah. I have some friends, man, who are extremists. They're like, hey, we want to, I want 5 peptides, and they want it all, just because money's not an option. I'm like, I'm not sure that's right, man.
Yeah, it's, you're going to get people like that. And those are the people that I said that, I very rarely ever do it for. Like they're persistent. That's what they want. They know more than me. Okay, fine. Fuck it. Whatever. Here you go. Fine. Here you go. You're paying me, whatever. Your lab work looks fine. You're healthy. Okay. You just get some people like that sometimes, but most people aren't like that, man. They really, yeah.
Well, man, I appreciate your time. You've answered all my questions, and I'm sure I maybe have to shoot you an email or two if something else comes up. But I mean, you've really given me some guidance, man, and you calmed my nerves a little bit, and I appreciate it, man. I'm excited to get started. And
yeah, man,
this is a great service. Your courses are great, man. Like I said, I've taken 5 or 6 of them. I'm getting ready to take the new peptide course. So I appreciate everything you're doing, man. You really are affecting a lot of people's lives, man. I appreciate you.
No, man, it's a pleasure to help, dude. So listen, I like the end of the episode with you asking me a question. Is there a curiosity or a question you've always had for me? Not related to your business, but more just kind of a curiosity, just a question directly, for me.
Yeah, man, I do actually. So in all your businesses, because the men's health and online, weight loss is kind of a new thing over the last 5 or so years. Have you had any pushback from like ACA? Have you had any kind of federal or state level agencies fuck with you at all, or has there been any kind of pushback on that end?
2 times. I've had some sort of regulatory agency or whatever kind of snoop around or something. Number 1 was Board of Pharmacy. I think it was like 6. It was in the first 6 or 12 months of being open. We were dispensing pre-filled syringes of testosterone to patients from the clinic supply, and the Board of Pharmacy caught wind of it basically, and they were like, "Listen, that's considered packaging. That's considered repackaging a controlled substance, and only pharmacists are allowed to do that. That's out of your scope." I'm like, "Well, shit, I didn't know that." They were like, yeah. I was like, well, am I going to get in trouble? They were like, we got bigger fish to fry. This isn't a priority for us. And so essentially the gist of what I got was stop doing it, and you're fine, kind of a thing. And you know what? That was 4 years ago. I've never heard a thing since. We stopped doing it. Okay. That's the thing about this kind of stuff, man. If you ever get in trouble regulatory wise, just stop doing it. And usually it's fine. Okay. If you keep doing it, that's when you start running into problems. All right. So usually you'll get a slap on the hand, you get a warning, fix the shit, and don't do it anymore. Okay. The other one was workman's comp. It was the state employment agency or something. Like my workman's comp insurance expired like 8 months ago, and I never renewed it. Cause I'm like, what the hell's the point in this? Why do I need workman's comp insurance? This is such a waste of money. And anyways, I guess they found out. I got a nasty letter. I was like, okay, fine. I spent the $500 on workman's comp. Like that's the only thing that's ever happened, dude.
Yeah.
Yeah.
That's cool, man. That's as successful as you are, man. That sounds like pretty minor offenses, man.
That's it, man. Minor offenses. Like I've always said in other podcasts, as long as you're not killing or hurting people, as long as you're not committing fraud, there's not a whole lot to worry about, man.
Yeah. I got a policy through Baxter You mentioned something in one of your courses I just took about having something in writing. I need to go back and read the policy because I asked her, the lady, hey, I'm gonna be doing in-home blood draws. I have a centrifuge. I'm doing all this stuff, in-home visits and blah, blah, blah. Am I covered? She's like, yeah, you're covered. So I need to go back and make sure that it's in writing, because the last thing I want to do is have some kind of error and not be covered for it. But
Right.
any advice on insurance? Last question. Any advice as far as understanding the policy or?
Yeah, just make sure that you're covered for what you're doing. Like if there's specific exclusions in the policy, and those exclusions will they'll be there in the policy. So don't buy it and sign off on it until you read that. Like you can hire a lawyer to do it for you, but just sit down for an hour and read through it. Okay. Like exclusion. We will not cover you for doing stuff off label. Okay. Screw that insurance policy because you're going to be prescribing stuff off label. You know what I mean? So like you have to read through the policy. There's a lot of exclusions. A lot of times they're very broad as long as it's within your, well, you know what? Prescribing off labels within your scope, doing a lot of this stuff is within your scope. Yeah. So that's that's my biggest piece of advice is actually read the policy, look at the exclusions and just make sure that what you're doing is not just written there as an exclusion. If it's written there as an exclusion, it's probably best to find another insurance policy.
Yeah. And then circling back to the tele thing, I mentioned to you via email, I'm in the process of getting licensed in every state. I have currently 26 MP licenses and many, many more pending. So obviously not from the jump, but eventually if I can figure all this out and get going, I definitely want to get, established in other states. Are you currently in other states, or do you just work in one state, or have you had have you found it challenging or do you know anyone who's had challenges operating a clinic in multiple states? Is that something you encourage, or would you have any thoughts on expand?
Yeah. I mean, you can, we only service one state, man. We're busy enough just in one state,
Yeah.
So yeah, I mean, you could expand in some other states for sure if you want to start marketing in some other states. I mean, listen, dude, if you want to start operating in another state, there's two things you got to have. You got to have a license in that state. You got to make sure your malpractice is going to cover you for providing services in that state. That's it. So you can load some Facebook ads up and throw it up in that state, and see what happens. I mean, what's there to lose?
Make sure your pharmacy and everything is contracted in that state. So
exactly. That's it, man. Yeah. So it could be successful and it could be a waste of money. You're just not going to really know until you give it a try.
Yeah. Well, I appreciate your time, man. I know you're busy, and I know you have a conference coming up, man. Again, I appreciate your time, and your stuff is great, man. Your product and your branding is great, man. I appreciate it.
Sure, man. Pleasure to help, dude. All right. Well, you take care of yourself. If you ever want to do a follow-up, just let me know.
Yes, sir. Have a good one.
All right. Cool, man. Thanks. Bye. All right, I hope everyone enjoyed the episode with Jason. Just a lot of great points there. A lot of really good questions that he asked. A lot of things that you should consider that, that we don't really talk about a whole lot. Your malpractice insurance, make sure you read the actual policy. Make sure there's no exclusions in there, regulatory compliance stuff, I've said this multiple times, stop worrying about stuff. If you're not killing people, if you're not hurting people, and you're not committing fraud, stop worrying about little minor details, okay? You're not going to lose your license. You're not going to jail over little tiny regulatory issues, okay? You're a business owner. You're a practice owner. You're going to make mistakes, okay? You're going to overlook some things. The regulatory agencies know this, all right? It's not a witch hunt to, steal your life from you, basically. So just keep this in mind. But anyways, this was a great episode. I would recommend listening to it again. Lots of great points. So hope everyone enjoyed it. Talk to you guys later. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.